Well, the school year is well underway, and we want to make sure that your child is getting the most out of their time in the classroom. And it all starts with a good night's sleep and a complete breakfast. Setting your kids up for success in the classroom by making sure their bodies are fueled and minds are rested.
Nutrition and sleep are very important for children for learning in school.
Dr. Cynthia Elsner with UPMC Children's Community Pediatrics Hummelstown says it starts with a good night's sleep.
A lot of kids who don't sleep well at night have more ADD, anxiety, and behavior issues, okay? They don't learn as well, so their scores on tests are a lot lower.
While the actual amount of sleep a child needs depends on their age, Dr. Elsner says you should aim for at least 10 hours each night.
So I usually try to tell parents that kids really shouldn't have any electronics in their bedrooms. And the other thing too is to turn off all electronics about an hour before bed.
Once they wake up in the morning, don't overlook the importance of a healthy breakfast.
I have a lot of teenagers here who skip breakfast, and I try and get them, I said, look, just get something in your belly. So a yogurt, peanut butter banana, a granola bar, an energy bar. So if you can just get them to get something in their belly, that's going to be better than nothing.
When it comes to lunch, Dr. Elsner says to make sure you're packing a fruit and vegetable, protein, and whole grains.
If children are receiving adequate nutrition, it helps them to focus better in school.
If your child gets lunch at school, go over what types of food they should be choosing while they make their way through the lunch line. And remember, the foundation you're helping them build now could last a lifetime.
If we eat healthier, we're going to be healthier. We're going to have less medical issues. And if we sleep well, we're going to be hopefully more productive in society as adults.
Now, Dr. Elsner says a good way to get your kids excited about eating healthy is to get them involved with the planning process, maybe let them make a meal or two. Now, once they're properly fueled and rested, there are a few things you can do to keep them happy and healthy in class. With school back in session, you may be noticing your little one with a runny nose or upset stomach.
The school environment itself can play a role. The crowded classrooms and close contact among students can facilitate the spread of infections.
But Dr. Devay Chaudhry, a pediatrician at UPMC Children Community Pediatrics Spring Grove, says there are also other factors at play.
So certain viruses are actually more common as the winter comes during the fall months. And this coincides with the start of the school year.
Vaccination rates, different regions, and safety measures at each individual school can also play a role in your child's health. Dr. Chaudhry recommends taking a holistic approach to keeping your kids healthy.
They can ensure their child is up to date on their vaccines, and one of the most effective ways to prevent against serious illnesses like measles, mumps, rubella, and the flu.
It's also important to teach your kids proper hand hygiene.
A parent can teach their child to wash their hands with soap and water for 20 seconds or so. And in the setting where soap and water may not be readily available, they can certainly use hand sanitizers.
And never underestimate the importance of a balanced diet and adequate sleep.
As caregivers of the children, can also make sure the child has a balanced diet, rich in fruits, vegetables, whole grains, so that they can be equipped to fight off infections.
They're practices that should be carried throughout the school year. Now, those are some great tips to follow, especially as we're in what doctors refer to as respiratory virus season.
We do see a few more respiratory viruses at this time of year. There are the common cold viruses, but the ones that we tend to think about are COVID, flu, and RSV.
Dr. Nazneen Iqbal, a pediatrician at UPMC Hummelstown, says that's because those three usually cause the most severe illness. So what can you do to keep your kids safe and healthy?
One of the best ways to protect our kids is to get them vaccinated. We have the new seasonal flu and the new COVID vaccine for this season have just been rolled out over the past few weeks.
And don't be afraid to skip those play dates and keep the kids home from school if warranted.
If your child is sick, just keep them at home.
While they're home, healthcare professionals say to make sure they're receiving lots of rest and fluids. Use ibuprofen and acetaminophen to treat fevers if they're old enough and seem uncomfortable. And try nasal saline sprays and humidifiers to help with congestion and coughs. Still, some symptoms warrant a trip to the doctor, including high fever and trouble breathing.
breathing fast, wheezing, sucking in their muscles every time they take a breath, or their nose is flaring every time they're taking a breath. Those are all symptoms of increased work of breathing, and this is not something that you can manage at home.
Unless CDC guidelines say otherwise, Dr. Iqbal says once your child is symptom-free for 24 hours without the help of medication, they're usually good to go back to school. If symptoms don't seem to be getting better after 1 to 2 weeks, it's recommended that you reach out to your healthcare provider. Now, it's not just sicknesses that can interrupt a school year. Heavy backpacks can also put a strain on learning. Here's how to make sure your child gets to and from school pain-free. Get those books, pens, and pencils ready. It's almost time to head back to school. Just be sure not to overload that backpack.
So children who have backpacks that are too heavy, it can definitely cause back pain for them. Sometimes if it's severe enough, can even cause some numbness down their arm, their neck.
But how heavy is too heavy? Dr. Kathleen Zimmerman, a pediatrician at UPMC Children Community Pediatrics in Camp Hill, says there's a simple formula to help.
If you weigh the backpack with all the items in there, it should not be more than 15% of the child's body weight.
The size of the backpack is also important.
If your child's smaller, you're not going to want to pick the biggest backpack. You want it to fit basically around their shoulder or maybe an inch below down to their waist. You don't want it hanging below their waist more than an inch or so.
Chest and waist straps can help keep the bag tight to the body and help make sure you're wearing the bag properly.
The most of the weight of the backpack to actually be right at the lower back. You don't want it to go below that. So a lot of kids will also just sling it over one shoulder, so it should always be on both shoulders, again tightly strapped so that it's actually touching the back and not hanging off the back, and that'll distribute the weight more carefully.
Backpacks with different compartments can also help distribute the weight.
The other thing is make sure that your child's not putting unnecessary things in their backpack. A lot of times there are extra books at home or extra books at the school that they don't need to carry back and forth.
If your kid's backpack is causing back pain, Dr. Zimmerman says a few tweaks might help.
And I have seen kids come in with back pain. A lot of times we just make a couple tweaks with the backpack and it really does help.
Well, another tip is to look at those straps. Wide padded straps can make a bag more comfortable to wear. Well, now that we've covered physical ailments, let's talk about mental health. New school years can bring stress and anxiety. Experts say after spending all summer with parents or caregivers, heading back to school can cause a little separation anxiety in children. There's also the stress of classwork, social interactions, and starting a new routine.
So some kids can get, what we call the Sunday scaries. They'll get really nervous or start talking about how they don't want to go to school. Some kids will even have actual physical symptoms. My belly hurts, my head hurts, I don't feel well. And you'll see this predominantly on a Sunday night right before school starts.
Now, the good news is there are a few things that you can do to help your children have a smooth start to the new school year.
So we know that kids, even teenagers, thrive off of routine, structure, and schedule. So I would say first start with maybe setting up the bedtime routine, moving it closer and closer to the desired bedtime of a school day, sort of setting up the same thing, maybe making good food choices in the morning. When it comes time for breakfast, having breakfast around the same time they would at the time for school. And then again, maybe taking some short drives up to the school, trying to get used to how it would feel like. And definitely take advantage of those back to school nights that a lot of the schools will offer.
Health professionals say during this time, communication is key. Talk to your kids about what's bothering them and remind them there is plenty to look forward to, like their favorite subject or maybe a fun project they have coming up. Now remember, if you have any questions about any of the topics we covered here today, don't hesitate to reach out to your healthcare provider.